Are you living with back or neck pain every day? Well, we recently headed out to Franklin to visit the Dr. Gil Center to find out some innovative ways they can help. Take a look.
Degenerative disc disease occurs when a person has an injury that was left untreated. A sports injury from years ago, a car wreck, a fall, lifting improperly. It can be posture, sitting too many hours a day, or sleeping on your stomach, which you shouldn't. It can cause strain to the neck and cause degeneration to occur there. Even heredity. So what happens is the disc begins to lose movement, the joint begins to lose movement. Once this joint stops moving properly, fluids and nutrients can no longer get in and waste products can't escape. So the disc begins to dehydrate and lose its water content and begins to flatten out. Here we see a normal spine, a normal disc. This disc is healthy, it's large, plump, a vertebra above and below. Here's phase one of degeneration. This disc has started to dehydrate. You can see how it's thinner. Then finally, as time progresses, the disc becomes even significantly thinner, bone spurs begin to develop, and the disc is severely dehydrated. And then finally here at the very last phase, this is fusion, where the spine begins to fuse together. Many patients wait until they're already in this phase right here. So the sooner that we begin to treat degenerative discs, the better. One of the main things people should do when they have degenerative disc disease is exercise regularly. Swimming seems to be the best thing. Even water aerobics, so you don't have to be completely underwater. We also prescribe specific exercises for patients to do when they're here in the office. They can do at home. In addition to that, we have a number of treatments that we use in the office. Spinal decompression therapy is the most effective treatment we found for non-invasive, non-surgical treatment of this condition. So it can be treated. You don't have to live with pain if you have this problem. This is a good example of a degenerative disc. Notice how the space in between the vertebrae has gotten very, very thin and dehydrated. The decompression therapy gently separates these vertebrae, creating a negative pressure or a vacuum to allow fluids and nutrients to re-enter that disc, to relieve the symptoms without drugs and surgery. Here we see the top of the disc. You can see how it's much healthier and tall here, hydrated, and this one's degenerated and worn down. On an MRI, a degenerated disc will appear black. A normal disc has white. We have a very special opportunity for the next 25 callers. They'll receive an examination, 2 x-rays, report of findings, and their first treatment, all for $39. The number to call is 794-0800, 794-0800 for this special opportunity.
Again, the first 25 callers to say they watch news and more at midday will receive an exam, 2 x-rays, their report of findings, and their first treatment, all for only $39. The number to call, again, is 615-794-0800.